The feeling of cancer is this burning fire in you that just doesn't stop. But at the moment you have this in your life, you have to continually move forward. When you see someone's facial expressions and the look in their eyes, and you know that they care, I get that from my husband and I get that from my doctor. If it wasn't for Dr. Briegel and her team up at OHSU, I wouldn't be here. Dr. Briegel, she looks through your eyes into your soul. Her comment to me when I had my first surgery was that, Shauna, we are going to be friends for many years.
Shauna is just an incredible, kind, generous, resilient, funny human being. I feel so privileged to have her in my life. For Shauna and I, we pair very well. I don't withhold anything, even if I think it's going to be difficult, because she deserves to know what I know.
She doesn't back down. This lady is amazing. She cares about you as a whole person, not just your medical condition. You are a human being to her. I have HPV 16, the most aggressive for causing cancer. If I would have known, I would have loved to have been vaccinated for it, because there's so much destructive things that can happen just from the HPV. Cervical cancer, it's kind of a silent killer.
It's largely preventable. We can vaccinate. That is the most powerful thing we can do. And I think for cervical cancer specific, really finding ways to increase participation in our screening programs. Pap smears, HPV self-collection. Communities who are suffering a greater disparity from this disease, do they have access to this? And if not, why not? Moving the needle to really be inclusive. Because those 4,000 deaths a year, they don't need to happen here. We have way too many resources at our disposal to allow one of those 4,000 women to lose their lives.
Did you fix my line? Oh yeah, there's that sound.
I'm moving forward somehow, some way, with the help of this team I have from the hospital and my husband.
I'm only one small piece of the lived experience that a patient is going through. They see me for 30 to 60 minutes in a visit every couple weeks, every couple months. And so knowing that they have unbelievable support through friends, through family, through partners, helps me know that they're getting the emotional and mental support that they need to continue. And that's where medicine happens, that's where healing happens for our patients.
Nobody goes into medicine without being inspired by a patient of some kind at some point in their life. It can be anywhere from your family member to people you have cared for. I get energized every time I work with my patients. How they pivot through very, very difficult times with their families is just really encouraging to me. The treatment of cancer starts before we even know somebody has cancer. We have a variety of different screening tests that we use, including colonoscopy, mammograms, pap smears for cervical cancer. This doesn't happen to every community the same way, and in some communities we're so afraid of the procedure, or we don't know where to get the procedure, or don't have insurance. So we sometimes enter the treatment of cancer at a much, much more advanced stage. We are probably able to reach communities better if we get to the communities rather than the communities trying to get to us. One thing we're doing right now, which involves a van that we have with community outreach and engagement, we are using this van to deliver education, for example, about HPV vaccination to prevent cervical cancer, which is a very, very big problem here in the state of Oregon and nationwide. We need to be able to get the community to do those screenings early, and the van's one of those methods.
I really believe that mobile outreach is the wave of the future when it comes to medicine. When I go into a community and work at a community event or connect with community members, it's very reaffirming to me to know that we're working in a job that is really trying to improve the lives of people throughout Oregon. A lot of interactions between research institutions and the communities that they live in can feel extractive. Oftentimes, they think that researchers or research institutions just come in and are looking for data and not thinking about the human element. I'm well aware of the burden that having to travel because you live in a rural environment puts on individuals. Two of my grandparents have died of cancer, and living in South Dakota, which is a rural environment, we always had to travel anywhere to go to a doctor, to go to a specialist. How can we build a long-term and meaningful connection with different communities, underserved communities, rural communities, communities of color? I know that this van is not going to answer exactly all of those issues, but I think it can be really helpful in helping to provide resources and education that will help prevent these sorts of cancers or help people get screened for them earlier with the resources that we have or the experts that we have at the Knight Cancer Institute and at OHSU. By consistently showing up and getting to know people, hear their stories, and understand their needs, it takes a big step in building trust between the community and the Knight Cancer Institute and science in general.
Trust is paramount because the medical and the research community has done us so many wrongs in the past. And how do we get past those historical wrongs to set and chart a new path that is based on trust and is based on collaboration? We need to be a community resource. We also need to be a community partner. We need to come and say, we don't have all the answers. We have lots of questions, but what questions do you have? The mobile van has a huge role going out, being embedded in those communities long-term and establishing those relationships with trust. And the cool thing is that it's mobile, so we can go into communities all across Oregon, big and small, remote and urban, and improve access for everyone. Health is a human right. We have a responsibility, quite frankly, to help do what we can to make sure that this basic human right is realized by everyone. And using our research knowledge and resources to diminish inequities in health by improving access.
I think it's very common for somebody to be afraid of knowing if they have cancer. It's not resistance, it's lack of understanding. One of the obstacles for patients is being afraid of being referred to the hospital and walking into a space where they don't know the language, they don't know where they are, they're coming from far, know the distance, or being away from family. We have interpreters, but a patient navigator is not an interpreter. An interpreter is only delivering parallel services where they're essentially translating and telling exactly what the doctor's telling, but there's no interaction other than that with the patient. A patient navigator is someone that not only speaks that language, but it's also serving as a person that shepherds the patient through the system. And so we can then mend that gap for patients so that when they meet their doctors and their teams in their language, and in a culturally sensitive way, navigate them through our system so they are in a position where they're more comfortable with the care. I think it's really important for us to understand the communities we're serving here in Oregon and abroad Oregon so that we can deliver the right services for the community to be able to access the wonderful treatments that we have to offer here. And that goes anywhere from training people to be in the healthcare workforce, anywhere from the front desk to physicians and people working in the lab. But it also involves for us to understand why are we not providing the same access.
building a healthcare system where people are healthy and able to reach their potential is the best way we can continue to really thrive, because we're all interconnected in this society. For me, preventative services with cancer, it just has to be a lot more innovative. We need more ideas, more perspective, different passions. Bench science is critical, right? Having these high-level technologies is critical, but partnering up. Are you working with someone who does policy? Do you have someone on your team that's involved with the community, right? To me, it's all about partnerships because no one can do it alone. And so the goal is, how do we create a culture and a structure of medicine that is truly preventative and is truly an open door for people to come in for health and well-being.
Removing the burden of cancer from the world, perhaps the most important goal that we have. We need to work at it at the cellular level, all the way up to the population level. And it also means being inclusive.
The reason I'm passionate about this work is because I think it's important to show a true investment in the community that we are a part of. The community being this local community of Portland, but also the community that is the state of Oregon. I think it's important for institutions such as the Knight and OHSU to really make sure that we are giving back and letting communities know that we have a true investment in the health outcomes and the lives of the people that we share this community with.
We really have to start thinking of cancer almost as a chronic disease. We're going to have to start thinking outside the box. We have already started that process here at the Knight. We have amazing science happening in the labs. We have great multidisciplinary teams that are working every day to make sure that the patients receive the care that they need. We also have the ability to translate what happens in the lab into the clinic, and we can start testing it here and then take it outside of here. I hope 20 years from now, we will have less cancer if we can help it. And if we have cancer, it's something that we can detect early and do something very quickly about it. Our people are what the Knight has. That is gonna get us there.
When you do what you love, passion moves you forward. It's when you're tired, when you're working 60 hours a week, when you have a tough patient scenario or you have to have a family meeting and deliver some tough news. Knowing that you are using every one of your skills to better humankind, to better someone's life, that's what propels you forward.